the differences. You see pain after food, that's gastric ulcer. Pain before food intake is peptic ulcer. Periodic is periodical. Periodic means like how often. It's more common, right? And then for peptic ulcer is more common, less common, more common. Peptic ulcer is more common than gastric ulcer. The issue of vomiting blood in gastric ulcer is more common than is more common. Why in a duodenal ulcer you have things like melena, dark stary stool, right? The dark stary stool is more common. In gastric ulcer you have weight loss, but in peptic ulcer you have weight gain instead, right? Now, gas gastric ulcer occur in both males and female, while in duodenal ulcer occur mostly in men. So that's it. So they have asked the next question. That's already is taking us to diseases of the respiratory system. That's diseases of the respiratory system. Part of it, like as we go and look at asthma and then diseases of the nervous system, still diseases of the gastrointestinal system. You see that this year section B came with mostly diseases of the digestive system, the gastrointestinal system. So take note of that. So asthma, we look at things like asthma. Asthma is a chronic obstructive pulmonary disease whereby the bronchi, the airway becomes narrow, becomes inflamed, start producing mucus, making breathing very difficult. So as asthma is defined as a chronic obstructive pulmonary disease whereby the bronchioles or the airway becomes narrow or it becomes inflamed and hence producing mucus, making breathing very difficult. And most often at times, what are the various medications that we give for patients that are suffering from asthma? We give them bronchodilators, we give them immunomodulators, bronchodilators like salbutamol. We can give them anti-inflammatory drugs, right? Like giving cortisol, right? So those are the various classes of drugs that we give patients like that. They have given us, they're asking us to give two classes of drugs, and we have listed three: anti-inflammatory drugs, bronchodilators, and immunomodulators, right? That's very important. Then epilepsy, epilepsy, right? Should I even answer that question? Surely some of us may understand what epilepsy is, because epilepsy is very easy, right? Epilepsy is a neurologic disease. That's the first thing you need to understand. It can be a congenital disease, or it can be you can acquire it in the course of time. You need to understand that it's a neurologic disease that affects the nerve cells of the body, whereby there is reoccurrence of seizures. There's reoccurrence of seizures. It's a neurologic disease, or it is a congenital or a disease that you can acquire in the course of time that comes as a result of a neurologic disorder which occur by seizures. Most people who have this condition at times, you see, when they want to get into a state of seizure, they find sparks of light coming to their brain. Immediately they find themselves falling. So what are the various classes of drugs that we use for patients that are suffering from epilepsy? Should I allow that as an assignment? Yes, I'll allow that as an assignment. People should go and do that. It's very easy. It's not difficult, right? And what are the purposes of the medication? The purposes of the medication is to relieve the patient from frequent seizures, right? Frequent seizures and adequate rest. Because most of them at time they love touching. They most of these patients at time they are also stubborn. And when you tell them what to do, they don't do it. So that's what we are seeing. So the aim of the drugs. So you guys will go and look for the drugs. Two classes of drugs used in the management of epilepsy is very easy. It's not difficult. Gastritis, right? Just as we have said before, erosion of the mucosal linings of the stomach, right? Or inflammatory response of the mucosal linings of the stomach. And there are many classes of drugs used in the management of gastritis. We have H2 receptor blockers. We have antacid. We have antibiotics. We have protein pump inhibitors. Protein pump inhibitors, right? If you want to look at H2 receptor blockers, you'll be looking at things like cimetidine, ranitidine, and all of that. Then you look at protein pump inhibitors, you'll be looking at things like omeprazole and all of that. Then antibiotics like metronidazole, amoxicillin, and all of that. And then antacid like G tablet, aluminum hydroxide, what they call that, Malox and all of that. So those are antacids, so much, right? So section C, if we have understood, section C,